Welcome to the channel. I am a doctor, and today I'll talk about never ignore these 7 early stroke signs. Most seniors miss number 3. The fear of a sudden, life-altering stroke is a constant shadow for many individuals as they enter their 60s and 70s. Yet the most tragic aspect of this condition is how often the body attempts to send out a warning before the catastrophic event occurs. A stroke is not always a lightning bolt from a clear blue sky. Frequently, it is the culmination of a series of small, nearly imperceptible neurological glitches that the average person dismisses as a normal part of aging. For a senior, the ability to differentiate between a clumsy moment and a life-threatening vascular emergency is the single most important skill for maintaining long-term independence. Medical literature increasingly focuses on the concept of brain attack awareness, emphasizing that every second the brain is deprived of oxygen, millions of neurons perish. Understanding the 7 early signs of a stroke, and specifically the elusive third sign that most seniors misinterpret, is a critical necessity for anyone looking to protect their neurological integrity in the later decades of life. The first sign that is frequently overlooked is a subtle, transient heaviness or laziness in a single limb. This is not the intense pins and needles sensation you feel when your arm falls asleep from sitting in an awkward position. Rather, it is a localized loss of fine motor control that might manifest as suddenly dropping a coffee mug or finding that your leg feels heavy while climbing a flight of stairs. In the senior population, this is almost universally blamed on arthritis, a bad hip, or general muscle weakness. However, when the vascular system in the brain is compromised, the motor cortex begins to lose its ability to send clear electrical signals to the extremities. This weakness can last for only a few minutes, a phenomenon known as a transient ischemic attack, or TIA, leading the individual to believe they simply tripped or had a momentary lapse in strength. In reality, these mini-strokes are the final warnings of a major impending blockage. A senior who notices that one side of their body is suddenly less responsive than the other, even for a brief window, must treat it as a medical emergency, as it indicates that the blood supply to the brain is actively being contested by a developing clot or narrowed artery. The second early sign involves a specific type of visual disturbance that feels more like an environmental issue than a physical one. This is often described as a graying out, or the sensation of a window shade being pulled down over one eye. Because many seniors already deal with cataracts, glaucoma, or age-related macular degeneration, they tend to assume that any blurring or dimming of vision is just their existing eye condition acting up. However, stroke-related vision loss is unique because it is usually painless and unilateral. It occurs when a small fragment of plaque breaks off from the carotid artery in the neck and travels into the ophthalmic artery, temporarily blocking the blood flow to the retina. This is a direct harbinger of a stroke that could affect the rest of the brain within hours. Ignoring a momentary blind spot or a sudden inability to see out of one eye is a gamble with one's life, as the eyes are effectively an extension of the brain's vascular network and serve as the canary in the coal mine for the entire circulatory system. The third sign is the one most commonly missed by seniors, and its subtlety is what makes it so dangerous. A sudden, inexplicable change in personality or a brief episode of existential confusion. Unlike the physical markers of facial drooping or slurred speech, this sign manifests as a momentary inability to recognize familiar objects or a sudden difficulty in performing a routine task, such as operating a microwave or finding the keys. Most seniors and their family members immediately attribute this to a senior moment or the early stages of dementia. There is a deep-seated fear of cognitive decline, so the instinct is to hide the confusion or laugh it off as being tired. However, a TIA in the parietal or temporal lobes can cause a sudden disruption in the brain's mapping system. If you or a loved one suddenly loses the thread of a conversation they were just leading, or if they look at a common object like a fork and cannot momentarily recall its name or function, this is not a sign of aging. It is a sign of a localized ischemic event. The distinction is critical. Dementia is a slow, progressive erosion of memory over years, whereas a stroke sign is an acute and sudden drop-off in function. Failing to recognize this sudden cognitive glitch is why many seniors miss the opportunity for preventative intervention, allowing the slow damage of microvascular disease to turn into a full-scale neurological catastrophe. The fourth sign is a sudden, high-intensity headache that feels unlike any previous tension headache or migraine. In geriatric medicine, this is often referred to as a thunderclap headache. For someone over 60 who may have lived with occasional headaches for decades, the tendency is to reach for an over-the-counter painkiller and lay down in a dark room. This is a grave mistake. A sudden, worst headache of your life scenario is frequently the primary indicator of a subarachnoid hemorrhage or a rapid spike in intracranial pressure. As the arteries in the brain age, they can develop small bulges called aneurysms. When these begin to leak or put pressure on surrounding brain tissue, they cause an intense radiating pain that may be accompanied by a stiff neck or light sensitivity. Because seniors are often on blood thinners for heart conditions, even a minor vascular leak in the brain can become life-threatening with incredible speed. A headache that comes on with lightning-like speed and intensity is a direct command from the body to seek immediate medical imaging. The fifth sign involves a disturbance in the internal gyroscope of the body, a sudden, profound loss of balance or coordination that isn't accompanied by the feeling of the room spinning. Many seniors suffer from vertigo, which is often an inner ear issue. However, when a stroke is brewing in the cerebellum or the brainstem, the individual will experience ataxia, which feels like being suddenly drunk. They might veer to one side while walking or find that their hand overshoots when reaching for a doorknob. Because seniors are often encouraged to be careful and use canes or walkers, they may perceive a momentary wobble as just a part of their frailty. The differentiator here is the suddenness. If you were walking fine 10 minutes ago and now you feel like the floor is tilted, your brain is signaling that its coordination center is underperfused. This sign is particularly dangerous because it often leads to falls, and the subsequent hip or head injury often masks the fact that a stroke was the original cause of the accident. The sixth early sign is a subtle change in the melody of speech, rather than the content. We are taught to look for slurring, which is easy to spot, but many stroke warnings manifest as aphasia or dysarthria in their mildest forms. This might mean simply struggling to find a common word or accidentally swapping syllables in a way that sounds like a slip of the tongue. A senior might say pass the salt, but it comes out as pass the belt. Often, the person is perfectly aware of what they want to say, but the connection between the thought and the motor function of the tongue and vocal cords is flickering. In the social circles of the elderly, these small verbal stumbles are frequently ignored out of politeness or attributed to being out of practice with conversation. Yet, this word-finding difficulty is often the brain's way of screaming that the middle cerebral artery, the most common site for major strokes, is being obstructed by a fluctuating clot. The seventh and final early sign is a sudden, unexplained bout of hiccups or nausea that feels neurological rather than digestive. This is more common in women and is frequently missed because it seems so unrelated to the brain. When a stroke affects the brainstem, it can irritate the nerves that control the diaphragm and the vomiting center. If a senior suddenly begins to hiccup uncontrollably or feels a wave of intense nausea that isn't related to a recent meal, it can be a sign of a posterior circulation stroke. These are among the most lethal types of strokes because the brainstem controls vital functions like breathing and heart rate. Because hiccups and nausea are so common in everyday life, they are almost never associated with stroke risk until it is too late. For a person over 60, any weird or persistent physical symptom that appears out of nowhere should be viewed through the lens of vascular health. The cardiologist and the neurologist both emphasize that the slow damage of these symptoms is where the real danger lies. When a senior experiences one of these signs and it goes away after 10 minutes, they feel a sense of relief. They tell themselves, "I'm glad that's over," and they go back to their daily routine. But in the medical world, a TIA is called a warning stroke for a reason. Statistics show that nearly 1/3 of people who experience a TIA will go on to have a major, debilitating stroke within the next year, with many occurring within just a few days of the initial sign. By ignoring these early indicators, seniors are essentially ignoring the fire alarm because they don't see the flames yet. The transition from a hidden vascular issue to a permanent disability can happen in the time it takes to brew a cup of tea. To prevent this, one must understand the biological sludge that leads to these signs. After 60, the inner lining of the arteries, the endothelium, becomes less efficient at producing nitric oxide, the gas that keeps vessels dilated. When we consume high-sodium foods, industrial seed oils, or hidden sugars, we are effectively coating our internal machinery in metabolic waste. This leads to the formation of vulnerable plaques that are prone to rupturing. The 7 signs mentioned are the physical manifestations of these plaques shifting, or the blood becoming too viscous to navigate the narrowed passages of the brain. The slow damage is a decade-long process, but the event is instantaneous. By paying attention to the signs, you are given a rare opportunity to reverse the trend. Medical interventions in 2026, including advanced blood thinners and minimally invasive clot retrieval procedures, are incredibly effective, but they are entirely dependent on the patient arriving at the hospital while the brain tissue is still salvageable. Furthermore, we must address the psychological barrier of stoicism in the senior population. Many individuals who lived through the mid-20th century were raised to grin and bear it and to avoid making a fuss. This cultural trait is a leading contributor to stroke mortality. A senior might feel the numbness in their arm or the confusion in their mind, but choose to wait and see if it gets better. In the case of a stroke, wait and see is a recipe for paralysis or death. The medical community is working to reframe seeking help not as an act of weakness or hypochondria, but as an act of strategic preservation. If you notice sign number 3, that sudden, brief fog or loss of routine knowledge, it is your duty to your family and your future self to report it immediately. The concept of time is brain is the guiding principle of modern stroke care. Every minute of a major stroke kills approximately 1.9 million neurons. By the time the full-blown symptoms of facial drooping and total paralysis appear, the window for the most effective treatments, like TPA, tissue plasminogen activator, is already closing. The 7 early signs are your pre-window opportunity. If you act when the limb feels heavy or the vision grays out, you might prevent the catastrophic event entirely. The doctor explains that we are no longer in an era where stroke is an inevitable part of aging. It is a manageable condition of the vascular system, provided the patient acts as an active participant in their own surveillance. As we look at the landscape of 2026, tools for stroke prevention, from wearables detecting atrial fibrillation to high-resolution imaging, have never been better. However, no machine replaces the human intuition of a senior who knows their own body. If something feels off, if the world looks different, your tongue feels heavy, or you forget how to use a remote, do not dismiss it as a senior moment. Protecting your brain requires a rejection of stoic silence and a commitment to acting on the first sign of trouble. The secret to longevity is the speed with which you respond to the whispers of your vascular system. The importance of the 3rd sign, the sudden cognitive glitch or personality shift, cannot be overstated. In senior life, cognitive slips are often treated with gentle humor. While born of love, this is dangerous. This hidden sign often results from a small clot in the thalamus or frontal lobe, areas handling executive function. When a senior experiences an uncharacteristic burst of irritability or apathy, it is often a sign that emotional centers are struggling for oxygen. This is the most missed sign because it doesn't fit the classic image of a stroke, yet to a geriatrician, it is a red flag of the highest order. Stealth triggers like dehydration or high-sodium meals can turn these early signs into major events. Dehydration makes blood thicker and prone to clotting, while salt causes pressure spikes. This is why the morning routine is critical. It is when the morning surge in blood pressure naturally occurs. If you wake up feeling unusually clumsy, do not wait for coffee to kick in. The caffeine surge will only increase pressure on strained vessels. Instead, reach for water and medical advice. The cultural narrative surrounding aging needs to shift toward vascular maintenance. If we treated our brains like our cars, we would never ignore a pinging engine. Sign number 1, the heavy limb, is a warning about the transmission. Sign number 2, the graying vision, is the fuel lines. Sign number 3, the cognitive glitch, is the onboard computer. As the driver of this machine, you require frequent inspections of these warning systems. Recovery is significantly impacted by how early signs are recognized. By acting early, you minimize infarct volume, the amount of dead brain tissue. A person acting on sign 6, a verbal stumble, might return home with full function. One who waits until speech is lost might never regain their voice. The stakes are your ability to communicate and remember the faces of your grandchildren. Sign number 6, the melody of speech, involves the middle cerebral artery. When a senior experiences dysprosody, a change in voice rhythm or pitch, the fine motor control of the larynx is failing. This may sound like a monotone or an uncharacteristic sing-song cadence. It is often accompanied by paraphasia, using the wrong but phonetically similar word, such as pork instead of fork. These are the shutters of a failing vascular system. The 7th sign, neurological hiccups or nausea, is the most exotic. A brainstem stroke can present exclusively as nausea and vomiting without weakness. If a small clot irritates the brainstem's chemical trigger zone, the body responds with intense nausea. The clue that this is a stroke, not a stomach flu, is the suddenness and absence of fever. The adoption of a zero-tolerance policy toward neurological glitches is not merely about health. It is about the preservation of one's legacy and daily autonomy. In the landscape of 2026, where medical intervention can literally pull a patient back from the brink of paralysis, the only remaining barrier is the human delay. We must recognize that the brain's resilience is a finite resource that diminishes with every passing second of reduced blood flow. The subtle laziness of a hand or a transient moment of existential confusion are not inconveniences to be ignored, but life-saving signals from a system under duress. By treating these 7 signs with the gravity of a full-scale emergency, you are exercising the ultimate form of self-advocacy. True vitality in the senior years is built on a foundation of proactive vigilance. It requires a fundamental shift in how we perceive our bodies, moving away from a passive acceptance of decline toward an active mastery of vascular health. This means rejecting the cultural pressure to stay quiet or the fear of appearing alarmist. Your memories, your voice, and your ability to move through the world are worth the effort of 100 false alarms. The signs are clear, the technology is ready, and the window for action is open. Reclaim your future today by promising yourself that you will never again miss the whispers of your own brain. When the body speaks in the language of a stroke, silence is the greatest enemy of survival. Be the one who acts, because your future self is counting on the decisions you make in these critical, early seconds. The philosophy of active mastery extends beyond individual vigilance into a broader commitment to long-term neurological wellness. In 2026, the medical paradigm has shifted from reactive treatment to high-precision prevention. But this shift is only effective if the patient remains the primary observer of their own condition. By refusing to dismiss a sudden bout of clumsiness or a strange verbal slip as a natural byproduct of age, you are effectively taking command of your biological narrative. This proactive stance ensures that you do not become a passive victim of vascular sludge or micro-blockages. Every decision to seek a professional opinion after a warning whisper is a strategic investment in your future clarity and physical independence. Protecting your brain is the most significant gift you can give to your family and your future self.